Standing up for Milwaukee, this is the Mark Belling Late Afternoon Show on News Talk 1130 WISN. As I mentioned before the break, the United States House of Representatives today voted to repeal Obamacare. We're joined by Congressman Paul Ryan. Paul, good afternoon.
Hey, good afternoon. It's been a while. How you been?
It has been. This doesn't really do anything because the Senate's not going to pass the bill. So what was the point of today's vote?
That's what everybody seems to ask us. The point was to reassert the fact that the Supreme Court is not the final arbiter of this. We had two chances as of a few weeks ago to get rid of this law. We lost one, the Supreme Court. And to reassert the fact that this is in the hands of the people of this country, through their elected representatives, they can still repeal this law. We had the votes in the House of Representatives, which we proved to do that. The stopping block, the blockade, is the Senate and the President. And so we're also trying to highlight the fact that if we knew then what we know now about this law, there's no way it would have passed. There's no way the 7-vote margin that they had in the House and they had no votes to spare in the Senate to pass this. When they passed this in the last session of Congress, they said if you like what you want, you can keep it. That's not true. They said this will lower health care costs. That's not true. Premiums are going up about $2,500, and that it doesn't have a tax increase on anybody. Well, there's 21 tax increases in this bill, 12 of which hit low and middle income workers. And so the empty promises have already been refuted, and we think we should bring attention to this because this thing is not only going to dramatically damage our health care system, it will blow a hole in the deficit and do a lot of damage to job creation. And so we want to bring attention to this because we want to show the country it is now up to you. You get to decide this November, not only what kind of country you want to have, what kind of people you want us to be, but whether this law really stands or not. And that's
well, there are a lot of people who, the House and Senate, they don't remember which one of you is controlled by the Republicans, which one is controlled by the Democrats. By taking this vote and then people hearing nothing's going to happen after that, it makes it pretty clear to them.
That's exactly
that one side wants to repeal it and the other side doesn't.
That's right. So Wisconsin, for example, we can make a big difference by electing a Republican to the U.S. Senate in November. We can make a big difference by sending our 10 electoral votes to Mitt Romney instead of Barack Obama in November. And those differences, which particularly in our state, can be the difference as to whether Obamacare stands or falls. Because it doesn't get fully implemented until 2014. So there's one more chance, which is in 2013, the next Congress, House and Senate, and President, that will determine whether this law stands or not before it is fully implemented in 2014.
Governor Romney, in running for president, has said repeatedly that he wants to repeal and replace Obamacare. I know there was some discussion about whether or not you were going to advance a separate health care bill as part of this, and you didn't. You merely voted to repeal Obamacare. What was the reasoning for not laying out an alternative, that there isn't a consensus on one, or that would be putting the cart before the horse?
Both. We didn't want to sort of basically say, well, here's our 2,500-page version of what we think the world should look like in healthcare. We don't want to make the mistakes the Democrats made, which is we've got our one massive bill, which is our vision of healthcare for the world. We're going to do this in a smart, methodical way in front of the country, step by step. Number two, there are some differences of opinions down at the detail level as how best to achieve this. We largely think, I co-authored the HSA law, health savings accounts. We largely think we need to go toward consumer-directed, patient-centered health care and the discriminatory tax treatment of health care so you can equalize that so everybody has the same tax benefit when it goes purchasing health care. Have transparency on price, quality, outcome data. So we know exactly what healthcare services cost whether we're going to.
But the point is, you didn't pass anything today. I was going to ask and I want to ask a follow-up of that. Do you think that Governor Romney, as he runs for president, will have to offer a specific alternative or not? Because certainly he can reach a consensus with himself as to what he should do. Or does that muddy the waters?
I think it probably muddies the waters. But he's also put out some pretty big specifics on the basic.
He has. He's given you the thought process. He has.
Medical liability reform, interstate shopping for health insurance, risk pools for people with pre-existing condition, transparency on price, quality data, equalize the tax treatment of health care. Those basic 5 things are the components of any market-based, patient-centered healthcare solution. He's articulated more detail than that on the components of it. And so it really gives you a picture and a vision of what I call a patient-centered healthcare system where everybody has access to affordable care, including people with pre-existing conditions, without the government taking it over.
Because the challenge to Obamacare was based primarily on the individual mandate. That aspect of that, of the bill, got so much attention, but there's a couple of other things that are just huge. I want to ask, first of all, about Governor Walker in Wisconsin saying that we're not going to move to implement the health care exchanges, the default thing that people would go into if their employer didn't have health care. We're just not going to create them. Theoretically, if every governor said that, or if a number of them say it, what does it do to Obamacare if the states aren't going to set up the exchanges? And do you think that under the Obamacare law, they can force a state like Wisconsin to set up an exchange?
No, they can do a federal exchange in its place.
They can, but that means they're running it at the federal government's cost.
So I encourage Scott not to set it up. So we always obviously talk about it, and our DHF secretary in Wisconsin, a guy named Dennis Smith, is a really smart guy, very good healthcare reform guy. Came from the Heritage Foundation. The rules that Obamacare requires Wisconsin to set up are so terrible in that I think it will do damage to our Wisconsin healthcare system that why would Scott want to start that now when it does, in our opinion, damage to the system?
Well, and I'm driving at this because I think this is an important point. The reason states don't want to do it is they think that it would damage the system and they think that it would cost the states money. The reason that the feds said they want the states to run these exchanges is the feds didn't want to pay for them.
That's right.
So is Obamacare not an acknowledgement that this is forcing the states to raise their taxes to run these exchanges, which are going to cost a fortune? Otherwise, why wouldn't Obama want to run his wonderful exchanges?
Absolutely. And what it will end up doing, in our opinion, and I'm on the committee that wrote this law, the Ways and Means Committee, it's going to knock us down to about 5 health insurers left in America when it's all said and done. And they will basically be like your public utility company. They're going to be like, Alliant Energy or We Energy, but for healthcare. And there'll be a government-run large insurance company. Why would our governor want to be complicit with setting up that kind of a system? It's going to force the small and medium insurers out of business. The big ones survive, and we really aren't going to have any choices. And what it also does is it encourages employers to dump their employees into the government exchange, into Obamacare. And so we think this is going to be such a disaster for the quality of health care, the cost of health care, and it's going to put the government in the middle of making the kind of decisions about what kind of health care we get. And so we have one more chance this fall through the election to repeal this. And so if I were Scott Walker, I'd be hoping that happens, not setting up the exchange now, so that if we win in 2012, in 2013, we replace this law with what I call patient-centered health care, and then we can work with Scott and Dennis Smith in Wisconsin to have health care reform that really actually works.
The other component that is only being talked about a little is the changes of Medicaid. Medicaid is low-income health care for the low-income. The Obamacare moves more people onto Medicaid, but it's going to reduce the amount of money that the federal government is spending on Medicaid. That's obviously a massive burden for the states. But the Supreme Court said if a state doesn't want to do it, they don't have to do it. I'm trying to figure out how Obamacare can work if the Supreme Court has said they can't order the states to change their eligibility for this. Have you sorted that out?
Yeah.
And what would happen to Obamacare if it comes into effect the way the current law is written?
Yeah, here's what's going to happen. I spent a long time with the CBO director on yesterday about this. So Obamacare was forcing the states to increase their Medicaid rolls by a third, adding 17 million people to Medicaid, and then sticking the states with some of the tab. The Supreme Court said you can't do that, which is a good ruling. Now the states are faced with, well, we don't have to do it, but should we do it? And most states are going to say no way, because here's the deal. If the states don't add these 17 million people to Medicaid, then they'll just go on Obamacare, and the federal government will pick up 100% of the tab. The kicker to this is Obamacare is a lot more expensive to the taxpayer than Medicaid is. And so this will have a huge increase in the cost of this healthcare law, Obamacare, and states now have the incentive not to increase their Medicaid rolls because they don't have a gun to their head from the federal government.
Obama's own home state of Illinois is already going broke in part because of their massive Medicaid costs. I could see Illinois saying we're not going to accept the Obamacare Medicaid thing, his own state rejecting it and dumping it back on the federal government. Those two things here that I mentioned, I just think mean that Obamacare is going to cost way more than we were told that it will, because the whole program is going to be run by the states, because the states aren't going to be dumb enough to set up an exchange, and the states aren't going to be dumb enough to accept Medicaid costs that are going to bankrupt themselves.
27 states sued the federal government over this issue. You think those 27 states are going to then, now that they don't have to, crank up their Medicaid program by?
No, they're not. And this means that Obamacare's costs are way more than when it was passed, because we now know that all these people that were going to either be in exchanges run by states or in Medicaid run by states are going to be part of a federal program run by the federal government, right?
And yes, and the irony of this ruling is it actually advocates the liberal progressive theory of this, or what the president ultimately wanted. The reason they put all these people in Medicaid is because it costs less and it got their coverage numbers up. They always wanted to put all these people in Obamacare in the first place, but it blew up the price tag of the law. Now that the Supreme Court pulled this out and these people will effectively now go on Obamacare, that's actually what they want. Now they can blame the Supreme Court for just cranking up the costs.
On a related but separate issue, Medicare, where you've been the leading Republican voice on reforming the system, talk about how that issue plays out in 2012, because the Democrats will try to simplify this into saying that the Republicans, like Ryan, want to gut Medicare. How do you see it playing out in the campaign? And is the Republican position, or at least your position, easy enough to be able to explain to knock down that argument?
Absolutely. And it's going to be a big issue in the campaign, no two ways about it, because Medicare has the biggest unfunded liability. It's the biggest empty promise the government's making to people, and it's the largest driver of our debt. Tens of trillions of dollars of empty promises are being made in Medicare. There are two ways to go. What Obamacare does to Medicare is it takes $500 billion from Medicare to spend on Obamacare. Just like government has been raiding Social Security to pay for other programs, Obamacare begins that process by raiding Medicare to pay for Obamacare. And then at the end of this year, he puts a new board of 15 people in charge of Medicare to cut prices to providers, cut reimbursements to providers, and cut Medicare in ways which lead to denied care for current seniors. It's really effectively a rationing board. So that's what it does to Medicare. And even with all that, Medicare's trust fund still goes bankrupt in 2021. What we do is we get rid of the rationing board, stop the rating, and we say, if you're already on Medicare or you're about to retire, you're 55 and above, we're going to leave you alone. We're going to leave the program as it is today because you've already organized your retirement around it. But in order to cash flow that commitment to people in and near retirement, we must reform it for those of us who are younger, 54 and below. And the way we propose to reform it is so that the system works just like the one that we in Congress and federal employees have. You have a list of guaranteed coverage options to pick from. You pick your plan. You can change it every year. And Medicare subsidizes your premiums based on who you are. More for the poor and the sick and the middle-income person, less for the wealthy person.
How many times do you think you've just given the answer you've given me? You've had to explain this a zillion. You know, I went to Summerfest. I saw a bunch of oldies concerts. Among them, I saw the Beach Boys. You know, I saw Neil Diamond, and I was thinking to myself, how many times has he performed Sweet Caroline? And the members of his band, most of which have been with him since the 70s, how many times have they played this song, and aren't they just sick of doing it? You've been asked that question, and you explain your Medicare plan obviously better than everyone, but you got to go through that whole 90 seconds each time.
That's right.
Does it get monotonous for you to keep going through that?
No, because I just came to realize that you just have to keep repeating these facts in order for them to sink in.
The reason I asked the question isn't just a joke. Everyone knows that the Republican who has explained these reforms best is you. Yet you've got a lot of Republicans right now that are willing to run on them, but they don't explain it as well as you. That is obviously a problem. You're more familiar with this than anybody else, and most of our listeners know you're smarter than just about everybody else, so it's easier for you to explain. Do you have a concern that some of this will be lost in the translation?
It has been my concern. Here's the problem. We have a debt crisis coming, and we can't wait around to educate, over a few years, a bunch of politicians and then do the right thing. because that debt crisis is coming fast. We needed to show the country a choice of two futures, an alternative to the president's vision of what I call a welfare state with a debt crisis. How do we get back to our balancing the budget, paying off the debt, getting back to the American idea of an opportunity society with a safety net? This is critical to doing that. And so, yes, we did lead with these reforms early on, perhaps before every member of Congress was articulate enough in order to explain all of these things. But we feel that we really owe the country the choice. The people of this nation have the right to decide for themselves.
I agree,
what they want.
I agree, but it's got to be explained to them correctly. And
I spent a great deal of my time working with members of Congress on just this point.
You explain it better than anyone.